Sleep deprivation is increasing among clinicians and nurses in the medical field. It is an increasing problem not only for the clinicians and nurses themselves, but also the patients they care for and anyone else they may come in contact with. Throughout this presentation, you will learn to understand sleep and sleep deprivation, understand how sleep deprivation affects clinical performance, understand quality care and patient safety practices, and how to utilize effective methods to overcome and prevent sleep deprivation. In order to understand sleep deprivation, we must first understand sleep. There are two stages of sleep, REM or rapid eye movement and non-REM sleep. REM sleep accounts for 20 to 25% of our sleep, while non-REM sleep makes up the remaining 75 to 80%. Both of these stages alternate in cycles of about 90 to 110 minutes before the cycle repeats again. Non-REM sleep is characterized by low brain activity and preserved movement, such as turning or adjusting positions. Non-REM sleep is divided further into 4 stages. Stage 1, also called light sleep, accounts for 2 to 5% of our total sleep time and occurs at the transitions of falling asleep and waking up. Stage 2 accounts for 45 to 55% of our total sleep time and is characterized by sudden increases in brain activity. Even though non-REM sleep is a level of low brain activity, in Stage 2, the brain experiences sharp increases and decreases in activity. There is not sustained brain activity in Stage 2 like we will see in REM sleep. Stages 3 and 4 together make up deep sleep. This accounts for 3 to 23% of total sleep time. It is the most restorative stage of sleep, and it is also the stage in which it is the most difficult to wake up. The length of time in this stage can vary depending upon what the body needs. If there has been severe sleep loss, the body will increase the time it is in stages 3 and 4. Now we move on to REM sleep. This cycles about 4 to 5 times a night. There is very little movement in this stage except for breathing and rapid eye movement. There are high levels of brain activity in this stage, which leads to dreaming, irregular heart rate, and irregular respirations. REM sleep also plays a key role in memory consolidation. There are 2 ways your body regulates sleep: homeostatic drive for sleep and circadian rhythm. Homeostatic drive is the body's desire to sleep after excessive hours of being awake. This usually occurs after 15 to 16 hours of being awake. This can cause a decline in cognitive performance and deficits in attention. Circadian rhythm is your body's 24-hour cycle. This is controlled by your hypothalamus, which secretes melatonin, which makes you tired. Melatonin is triggered by lack of sunlight, which explains why working night shift can throw off your body's sleep patterns. Circadian rhythm can also decrease alertness when it is time for your body to sleep. Sleep deprivation is divided into 2 categories, total and partial. Total sleep deprivation is an acute case such as pulling an all-nighter to study, while partial sleep deprivation is an accumulation of many nights of poor sleep. Because of rotating shifts, shift work often causes partial sleep deprivation. However, being on call for 24 hours or more can lead to acute sleep deprivation. Sleep deprivation can be caused by 4 mechanisms. Insufficient sleep means the body did not get enough sleep time. 6 to 10 hours of sleep per night is recommended. Fragmented sleep is adequate sleep time, but with several interruptions that do not allow the body to spend sufficient time in restorative sleep. A common example of fragmented sleep is being on call. Underlying circadian rhythm abnormalities can also lead to sleep deprivation. Menstruation, pregnancy, and menopause have been found to cause negative effects on sleep quality and quantity in women. And of course, primary sleep disorders can also cause sleep deprivation. These include sleep apnea, restless leg syndrome, and insomnia. Shift work is a method of scheduling often used within the medical field. Shift work includes long 12-hour shifts that can be exhausting or even longer than 12 hours. On average, trainees work about 80 hours a week and clinicians work regular 100 to 120-hour weeks. On top of working long hours, many clinicians are on call for an extended period of time. Usually, the amount of time on call lasts anywhere from 24 to 36 hours. Many clinicians, nurses, and trainees have lives outside of their work. If they come into their shift unrested, it only leads to more sleep deprivation. This picture shows an average work schedule in 2009 that had employees working different hours every single day. Sometimes the workers only had a couple hours after their last shift before their next shift. Shift work can often lead to many mistakes as a result of sleep-deprived workers. For example, if a clinician is called in for emergency surgery, it can often change their schedule and cause them to be fatigued during the procedure. When performing surgery, clinicians need to be alert and maintain quick reflexes. Sleep deprivation can lead to low levels of alertness, which can cause patient care errors and increase in injury among medical personnel. Also, sleep deprivation is relative to being intoxicated. This can lead to an increase in car crashes from the hospital and death of patients if they are under the care of sleep-deprived medical staff. Medical personnel that are sleep-deprived are often grumpy and do not care well for their patients. They may become impatient and irritable. This is nothing but disaster for a job in the medical field. Mistakes are common when people are sleep-deprived, which can lead to punishments, death of patients, and termination from the job. It has also been discovered that sleep deprivation can increase an individual's risk for heart disease, diabetes, and some types of cancer. It has been found that healthcare workers' safety and performance are compromised due to shift work. Their job is very important and a lot is jeopardized when they are not performing to their highest standards. Diagnosis, treatment, procedures, and the safety of both the provider and the patient are some of the things at risk. In the next few slides, we will view statistical results of the performance of healthcare providers suffering from sleep deprivation. The first graph we are going to look at shows the cognitive abilities and performance in relation to the length of time a provider has been awake. During this study, the individuals slept in 8-hour increments at the same time for 6 nights. They then remained awake for a 26-hour period and were asked to perform tasks every 2 hours. This showed that the performance was worse directly after waking up. While it also varied slightly when they remained awake for a long period of time, a lot of residents and physicians performed tasks in response to a page after taking a cat nap. This could definitely be a large factor in medical errors. The data shown on this chart represents motor vehicle incident reports in relation to duration of work hours. This study tracked actual motor vehicle crashes, near-miss accidents, and percutaneous injuries sustained on the job. The report shows a higher number of both near-miss accidents and actual crashes following an extended work shift. There was also a rise in percutaneous injuries while the residents were on duty after being on call the night before. This figure proves that not only can sleep deprivation be unsafe for patients, but also for healthcare workers. This chart represents medical errors made by residents in relation to the number of extended shifts they worked in the past month. This graph is divided into minor medical errors resulting in adverse outcomes, and medical errors resulting in fatalities. The blue column shows fatigue-related incidents, while the yellow shows non-fatigue-related incidents. As the number of extended work shifts increased, so did the fatigued and non-fatigued related events. For minor medical errors, fatigue-related incidents rose above non-fatigued events as soon as extended work shifts were completed. For both adverse outcomes and incidents resulting in death, fatigued incidents did not surpass non-fatigued events until 5 or more extended work shifts were completed. Everyone makes mistakes, but it is very important for healthcare providers to be able to perform to the best of their ability, which is sacrificed when they work extended hours. To avoid such medical errors, patient safety practices need to be set into place. These practices play a key role in quality care. Quality care always provides a safe environment for patients, effective treatments, and efficient care that is completed in a timely manner. Most importantly, quality care is patient-centered. In the next slide, we will see how patients are affected when safety practices and quality care is diminished. Each year, approximately 1.3 million patients are injured from errors that occurred during hospitalization. More than 100,000 deaths occur due to adverse events that could have been prevented. Now, let's take a look at how shift workers typically deal with sleep deprivation and how this affects their work performance. Shift workers are no stranger to caffeine. Caffeine takes effect in 15 to 45 minutes after ingestion and remains active for 3 to 5 hours. Caffeine is most effective when consumed early in the shift. However, crashing is a common side effect from the decline in caffeine. Medication is also used by shift workers that have trouble sleeping at night or experience insomnia, but these have side effects as well. There are several topics we will discuss in order to effectively fight sleep deprivation. These include efficient rest, bedroom design, food and exercise, staying alert at work, and driving home. Shift workers should try to take brief 15-minute naps, also known as therapeutic naps. These naps can soothe sleep deprivation but should allow for adequate wake time. Shift workers should maintain a consistent bedtime and wake time that is similar on both work days and days off. For employees that rotate shifts, try to rotate shifts forward. By creating a pattern of day shift, evening shift, night shift, you can help to keep your body's circadian rhythm. Also, try to stick to shifts of your preference. If you are a morning bird, pick up more morning shifts, and if you are a night owl, pick up more night shifts. A shift worker should also manage their amount of work hours. An employee should take off 10 hours after working an 8-hour shift and 12 hours after working a 12-hour shift. A vacation is always a good way to restore the body with the adequate amounts of rest. Bedroom design can be adjusted to create a more conducive environment for sleep. Room darkening shades allow your melatonin to be released even during the day. Decreasing room temperature can also encourage sleep. Earplugs and eye shades should be worn especially when sleeping during the day to block out noises and light that may keep you from staying asleep. Be sure to set guidelines for family and friends. It is likely that you will require sleep at times when your family or friends are active. Make sure sleep is a priority and ask not to be disturbed during these sleep times. Finally, disconnecting or turning off your phone can limit further distractions. Food and exercise also has a large impact on your ability to achieve a well-rested sleep. Although caffeine is useful throughout your shift, be sure to avoid it at least 5 hours before sleeping. Eat nutritious foods and adequate meals during your shift. When working 12 hours, eating at least 2 meals is sufficient. Also, select foods that will not cause major fluctuations in blood sugar. Heavy meals, exercise, and alcohol should also be avoided right before sleeping. Employees have been seen to become most tired around 4 a.m., so it is best to plan more stressful or intensive activities at that time. Each employee should have short breaks scheduled to walk around and keep alert. Each worker should develop a system of their own to monitor their behavior. It is also helpful to create a partner system to watch everyone's behaviors, especially in alertness and motor tasks. Do not rely on medications to keep you awake. These may have severe side effects. The drive home is also an area of concern. 20% of injuries sustained in car accidents are caused by driver sleepiness. Measures can be taken to avoid such accidents. Try to carpool. Having a passenger to make conversation can help keep the driver more awake and alert. If possible, it is best to avoid driving altogether by using public transportation. If you do drive by yourself, drive defensively to keep focused and do not stop on your way home. Your goal should be to get home safely. In addition to employees' efforts, employers should also be making contributions to fight sleep deprivation. Employers can try to reduce work hours of employees overall. This may be difficult but can be solved by hiring as-needed workers to help in a time of need. Facilities can apply safeguards in case of a crisis resulting from sleep deprivation that will encourage workers to be well rested and happy to come to work. Also, alertness tests should be done when coming into work. If an employee shows low alertness, he or she should be sent home to avoid errors that may occur. If possible, the facility should allow numerous breaks in which the employees can take therapeutic naps if they feel overtired. Caffeine should be made available to employees at the beginning of their shifts. This picture lists questions that can indicate whether or not an employee is at an increased risk to make errors on the job. This could be used at the beginning of shifts to prove that a person is healthy and alert enough to work a long shift. After answering the questions, it lists suggested remedies to solve sleep deprivation so workers can continue with their work shift. In review, remember and recognize the mechanisms of sleep deprivation. Be aware of the errors that can occur due to sleep deprivation. Maintain a high quality of care and recognize when quality care is suffering. Make sure you are dealing with sleep deprivation in an effective manner, such as avoiding medications to keep you awake, and also develop a partner system to monitor everyone's performance and alertness at work.